well, thank you everyone for joining us for another episode of Quarantine Marketing, or as I'm affectionately referring to it, Track How Bad I Need a Haircut, from episode 1 to whatever, 5 or 6, whatever we're on right now. So it's getting bad, but we're going to make it through. We're joined as always by Matt Brandon. He's our creative director and marketing director. But we're also joined by Dr. Amanda, who is a nurse practitioner at Sandstone Family Medicine, under the umbrella of Sandstone Health, who we've had the privilege to work with for the last decade or so. And so,
not just that, but she is my family's doctor. We have done, yes, we have done 2 telemedicine consults since this whole thing started.
Yes.
That's not a HIPAA violation if I bring it up, right?
Not if you bring it up. Yes.
Okay, cool.
Yeah.
Is it a HIPAA violation if I ask you if it was for anything related to COVID-19?
Oh.
No, stuff has changed. Yes. Yeah.
Well, awesome. Well, so what we're going to do here, Dr. Amanda, is just get an idea of, you have a very unique perspective that you can offer right now. And so I think what we want to start with was, before we get into right now, what was the practice like? What was happening before all of this started?
So before all this started, we did offer a little bit of telemedicine here and there, but it was really more on a cash-based services because most insurance companies were not offering any coverage for it. So we offered it to a select few of our patients who were either out of town or had issues coming in because they may have worked far away. But most of our visits, or probably 95 to 98% of our visits, were all in-office visits before COVID-19.
Cool. So then COVID-19 hit, and like everybody's ordered to stay home. Exactly. And like even going to the doctor for things like an eye infection or a migraine or any of those other non-COVID related things that come up, people just stopped coming, I'm
Exactly.
sure. So as a caregiver and as a business person, both of those things, what did that feel like for you?
It was very scary to know, one, how was the practice going to continue? Were we going to be able to kind of build back up or give patients reassurance that it was safe to come to our office? And it was scary for me because I know that some of my patients needed to come in, because even though we're worried about staying home because of COVID, all the normal things are still happening. People are still getting bladder infections. You're still going to have a headache, a migraine. Lots of kids are still going to go outside and get bug bites, and all the normal things that they come in for, they were really trying to avoid coming in, but they were still at home suffering and possibly getting worse. And then the worry is if you let it go too long, are you going to end up needing emergency service care and then expose yourself even more? So those were kind of some concerns that I had for my patients.
Absolutely. So then, obviously you were able to make a pivot. You were doing some telemedicine before, but obviously you kind of had to lean into it more heavily after this started. So tell us about that pivot and what that change was like for you.
So once we found out that insurance companies were allowing their clients to come to use telemedicine as a way to get their services and provide coverage for them, it was more affordable for them. And some of the rules and regulations were, I guess, lessened on what we could use these services for. We started to kind of get the word out to our own patients that this was available. And since then, we've seen a huge increase in telemedicine visits. Probably about 50% of my visits right now throughout the day are actually telemedicine. And so they're for lab follow-ups, for, small acute things, and sometimes just for anxiety, depression, insomnia, lots of different things. And there are a few patients, when they're sick, we may need to have a physical exam. And so what a lot of people have done, or our patients have done, is use that initial visit through telemedicine to determine, do I need to see you? Do you need to come in? And then we can kind of work on what tests do we need to do and make that internal visit very quick and efficient.
That makes a lot of sense.
Mm-hmm.
That's great. So you mentioned you've seen about a 50% increase, but can you take me to a moment maybe where you realized that this is clicking, this is working, like this telemedicine thing, specifically for you, that it started working?
For me as a provider, or for our practice, I guess?
Yes, all of it.
Okay. So for me as a provider, I realized it was working when, I mean, people just started asking if we were doing it, you know, or we started to see more calls. And we actually put out a sign in front of our office that said we were still open and offering same day appointments, telemedicine, or in office. And I feel like as soon as we put that sign up, people started calling, asking about the telemedicine appointments. And so as soon as that happened, we really started to see an increase in numbers. And now we give kind of patients an option, you know, do you want to come in or do you want to have telemedicine? We still have some people that want to come in because they know that we're doing a lot of precautions to protect them and us, but a large number of our patients want to do the telemedicine for sure.
Yeah, I mean, I can echo that as a patient. It is so much more convenient to have that option. And I know it's not always possible because sometimes you're going to have to do labs, or you're going to have to do some kind of physical exam, or you're going to have to give some kind of injection or something that you can only do there. But I know when it's just something that it just requires a conversation, it's so much better than having to come to the waiting room for the patient.
Yes.
But what about you as the doctor? Do you like it? Are there benefits to it from the doctor's side as well?
So there are a few benefits. So I like it because it definitely gives me a little bit more one-on-one time with patients. Because if you think about it, when you go to a doctor's office, some of your visit is really spent checking in, getting your vitals, waiting, you know, and so you don't actually have that whole time period with your medical provider. Whereas with the telemedicine visit, you know, as soon as I log in, it's just a one-on-one between myself and the patient. So it's a more intimate conversation. I feel like I get a better insight and I get to spend a little bit more time with them. So it's definitely a more personal approach. So I do like that. The other thing that I like, and I think that patients like, is that they're my established patients, and so we already have a relationship, or you know, they're new patients, but they're going to continue to be able to use the service with someone that gets to know them. Versus sometimes telemedicine was used in the past. Some insurance companies provided it for you to do a quick sick visit or something, but you never get the same person twice, and they really don't know you well. The benefit of doing it through your family practice is I already know them. I know, you know, their history. I already know they don't like this medicine, or this is what they're going to want to do. And so we already kind of have that relationship. So that doesn't have to hinder or be changed. It's just a more convenient way to access care.
Awesome. Do you think it's more cost effective?
Maybe. I mean, not necessarily, because it's still regular office visits. It could be cost effective in the long run because of the convenience. I think it gives more access to care. So as I mentioned earlier, if it's more convenient for a patient to be able to seek resources early on before the condition becomes more severe, then in the end, it becomes more cost effective for insurance companies, for sure, and for the patient. Mm-hmm.
Yeah. So obviously, like, not just healthcare, but all businesses are having to pivot. Obviously, you're doing curbside delivery, this Zoom meetings, things like everything's changing. But I just have a feeling that some of these changes, consumers' eyes have been opened, and they're probably not going to want to go back to the way things were for a lot of things. Do you think that telemedicine is here to stay at an increased level?
I would hope so. I think it has great value. I mean, it's going to be very convenient, even when we're, say, back to completely normal. Wouldn't it be nice if you could do your telemedicine conference right at 5 o'clock and not have to leave work early to do it, to get there by 5, or you don't have to find a sitter for all your kids because you can just log in really quickly and do your visit, and the kids can play in the background. So it's definitely something that would be nice to be able to continue to offer patients after this is done.
Cool. Are there any, obviously this is a very good option for your practice. Are there any kind of other practices that this may not be a good fit for? Like, who is it good for and who is it not good for?
For telemedicine?
Yeah.
The only thing I would say that's a little harder is, you can't assess lungs, right? So definitely you can't always, for emergent situations, I mean, you can do a quick overview and look, but you can't really listen to a heart or lungs or things like that, or do any diagnostic testing. So it's not perfect for everyone, but for certain things, I mean, it has a great purpose, which is why our patients know, like, we do the visit, and then some patients I'll say, I really need to listen to you. Can you come in, and we'll just schedule you really quickly, and I'll just take a listen to your heart and lungs. And it can even be today, later this afternoon, as part of this visit. I just want to hear you, that kind of thing.
That's awesome.
Yeah.
Casey, you got any other questions?
No, just I like your observation there that for some things, the genie's not going to go back in the bottle. Like, consumers' eyes have been opened. And so I think telemedicine's one that it was already here, but I think it's here to stay, and people are more aware of it. Some people that maybe it wasn't on their radar. it is now. So I think that's great. So what would you say, Dr. Amanda, to maybe a provider who is unsure, kicking the tires, not so sure about this whole telemedicine thing?
I would say it's definitely a way to continue to connect to your patients and provide them with great service, because they still need the care. I mean, they're either not going to get it or they're going to go somewhere else or get something done very quickly. And it's definitely a better opportunity for you to be there for your patients and serve them if you can kind of adapt to the times and be able to provide these different things for them.
That's great. That's great. Well, thank you so much for joining us and for enlightening us and helping to educate folks. We really appreciate your time.
Thank you. I appreciate being on. Yeah.
Oh, I was just going to clarify. I've heard a couple different terms thrown around: telemedicine and telehealth. Is there a difference between those things?
So I think telehealth can actually refer to different services. So other providers can use telehealth services. So I know chiropractic can do some telehealth services via Zoom or Skype or one of those kind of things. And I think telemedicine is geared more towards just medical practice, as far as like a primary care or specialist, like a dermatologist, cardiologist, that kind of thing.
That makes sense. That makes sense.
Sorry.
Yeah,
Good follow-up. Good follow-up. We've seen both. And that's good clarification, because some people may start using that interchangeably, not understanding that, different things apply to different practices. So, all right. Well, thank you, Dr. Amanda. We really appreciate you joining us.
Yes, thank you so much.